name's Meredith Hartman, and I'm one of the BVA cataract and refractive surgeons. Today we're going to talk about cataract surgery. So cataract surgery is an elective procedure, and by elective I just mean there's no rush or urgency to proceed with surgery. Day of surgery, you'll typically get to the surgery center about an hour to an hour and a half before surgery starts. They'll get you checked in, you'll be nice and relaxed for the procedure, but not completely asleep, so it's not done under general anesthesia. Surgery itself usually lasts about 10 minutes, and then you go home that same day. You will follow up with one of your referring providers or someone at our office the next day, week later, and month later. Our office will arrange all of those visits for you. We never do both eyes at the same time, so I'll typically start with either your worst seeing eye or your non-dominant eye, and then assuming that you're happy and ready, we'll do your second eye anywhere from a week to 2 weeks later. Cataract surgery is a very safe procedure, but with any procedure, there's always risk involved. So let's discuss the risk and benefits. The benefits of cataract surgery are improved vision, decreased glare, and certainly improved contrast sensitivity. But with any procedure, there are always risks involved, so I'm going to tell you the main ones that we should be concerned about, although these are all very rare, but certainly not a complete list of all the risks involved. The risks involved with cataract surgery are infection and bleeding. Bleeding is a very low risk with cataract surgery, so if you use any blood thinners on a routine basis, those are perfectly fine to continue. I usually do not have you stop those before surgery. Infection is by far our biggest concern, and again, it's incredibly rare, but when it happens, it can mean potentially permanent loss of vision in that eye, so it is something we take very seriously. You'll be on an antibiotic eye drop 4 times a day following surgery. The other important thing that I ask is that you're not rubbing the eye after surgery, you're keeping it dry, clean, and protected. Women are abstaining from wearing eye makeup for at least the first week after surgery. Other risks involved are things like a retinal detachment. Although very rare, your post-op visits will include an exam that will help identify any changes early if this were to occur. I let everyone know, although it's rare, there occasionally are times where I'm unable to safely remove the entire cataract at the first time of the procedure, and we have to go back at a later date, whether it be with myself or someone like a retina specialist, to get the rest of the cataract out of the eye and put a new lens in place. When that happens, you can still have a wonderful outcome, but it does take a little bit longer to get there because it is a second surgery and longer healing times. Now I'm going to take the time to go over some questions that I routinely get during pre-op visits. Let's do a Q&A.
So Dr. Hartman, how many cataract surgeries have you performed?
So I've done a little over 10,000 cataract surgeries. I used to keep count after every case, and I stopped counting after I hit 10,000.
Thank you. So when you have cataract surgery, do you have to put a lens in the eye?
So when we do cataract surgery, yes, we do have to place a lens in the eye because you would be functionally blind without a lens. There are multiple options of lenses that we can put in the eye at the time of surgery. Some are covered by insurance, some are not covered by insurance. Some will make you less dependent on glasses or contacts following surgery. Those are all options we can talk about at your pre-op visit.
Can someone get a cataract again after they've already had surgery?
So yes, but not like the way you would think. So cataract surgery is a one-time deal, and then you can never get a true cataract again. The one thing that does happen frequently, in fact we almost expect it to happen, is you can get scar tissue that grows on the lens we implant in surgery. They call this a secondary cataract, although it's not really a cataract at all. It is just scar tissue. If it becomes visually significant, then we just do what's called a YAG laser in clinic and we remove that scar tissue. It's a completely painless procedure, takes a couple of minutes. Very easy to do.
So after cataract surgery, can our patients travel?
So what I tell patients about traveling after cataract surgery is that the highest risk for infection is the first week following surgery. So I would prefer for my patients to stay local for the first week after surgery in case anything were to happen, because we can more quickly diagnose and treat that if it were to occur. After the first week, your risk of infection is significantly lower, and so at that point I clear my patients to go back to travel. You can fly, drive, do anything that you need to at that point.
Great. Thank you, Dr. Hartman.
You're welcome. Thank you for watching these videos, and I look forward to discussing more at your pre-op visit in person. Thank you.